So if you see somebody with a pelvic health problem, let's take erectile dysfunction, and you give them a pill that works on nitrous oxide pathways like Viagra and Cialis, that does work and it fixes erectile dysfunction temporarily. There is zero reason why this needs to be a temporary thing. All you have to do is think for a couple of seconds, and if you understand how dry needling works, it becomes very, very obvious that this is easy to fix. And I can tell you guys from 10 years of experience doing this all the time, every week, I fix people that have had decades-long problems in a couple of treatments with dry needling. And it's not that the other treatment that they've gotten in the past is wrong. It's just that the people that were performing the treatment did not understand what needed to happen to this person's autonomic nervous system. My name is Jason Schuster. I'm a doctor of physical therapy. I own Integrated Spine and Body Solutions. It's a continuing education company teaching other doctors how to do a couple of things. In our online Dry Needling 2 class, Dry Needling to Improve Men's and Women's Pelvic Health, we heavily focus on why pelvic health problems develop in the first place, which is the biggest problem in pelvic health land, you guys. Most people that treat people for pelvic health impairments think that the muscles themselves are the problem, and then the muscles need to be stronger to be able to make normal pelvic floor function possible. So whether it's incontinence, pain with sex, erectile dysfunction, all this stuff, the vast majority of medical practitioners, the vast majority of literature talks about how muscles need to be stronger or hormone dysregulation, stuff like that. Erectile dysfunction, you guys, is totally, just absolutely horribly treated. 99% of all pelvic health impairments, erectile dysfunction included, pain with sex, incontinence, 99% of them, and I don't care how old you are, 99% of those problems are absolutely needless. There should be almost nobody suffering from these problems, you guys. The reason that pelvic health is such a big problem is many. Health in general in our country is in the absolute gutter. It's getting worse and worse every year. We're lowering our life expectancy. We have more chronic disease. We don't have any cures for anything, hardly zero cures for anything. The most common causes of problems, you guys, cancer, diabetes, heart problems, 85% of them are considered idiopathic or without a known cause. They're only considered idiopathic because we don't look for the cause in public health and mainstream medicine, and that is done on purpose. So if you see somebody with a pelvic health problem, let's take erectile dysfunction, and you give them a pill that works on nitrous oxide pathways like Viagra and Cialis, that does work and it fixes erectile dysfunction temporarily. There is zero reason why this needs to be a temporary thing. All you have to do is think for a couple of seconds, and if you understand how dry needling works, it becomes very, very obvious that this is easy to fix. And I can tell you guys from 10 years of experience doing this all the time, every week, I fix people that have had decades-long problems in a couple of treatments with dry needling. And it's not that the other treatment that they've gotten in the past is wrong. It's just that the people that were performing the treatment did not understand what needed to happen to this person's autonomic nervous system to facilitate resolution of the problem. Just blindly targeting random muscles for erectile dysfunction or incontinence, that may help if it's a very, very minor problem where the nervous system hasn't become too dysregulated. But the problem with the pelvic floor, you guys, is that the 9 true pelvic floor muscles are the most parasympathetic dominant group of muscles in our body that we have. Erectile dysfunction is a parasympathetic activity problem. So you would think that an erection in a guy is a sympathetic process. You think, yeah, we're all excited, we're going to have sex, the sympathetics go up, you get an erection. That is not how the human body works. It's very counterintuitive. So an erection is a parasympathetic dominant problem, meaning that if the sympathetics are too hyperactive and the parasympathetics are depressed, the parasympathetics can't turn on to function how they need to. So it's the same reason, the same thing that causes most people sleeping difficulties is the same thing that causes guys to have erectile dysfunction. If there's no underlying structural pathology like significant prostate cancer, damage to the muscles, damage to the neurovasculature. If that's not the case, and that is not the case in over 95% of people suffering from ED or any other pelvic health impairment, if there's no underlying structural pathology, that problem is absolutely fixable. It's very, very easily fixable just with dry needling. And if you add in other treatments, including nutrition, supplementation, education on how to eat better, how to depress your sympathetic nervous system with a bunch of different through a bunch of different mechanisms. So we can do it with dry needling, we can do it with lifestyle changes, we can do it with eating different food, exercising. But all you really need to do to fix the vast majority of pelvic health impairments for guys and girls is all you need to do is depress the sympathetic autonomic nervous system enough and elevate the parasympathetic autonomic nervous system enough where you bring the ANS back into that individual's realm of being able to self-regulate. So there's a spot in the autonomic nervous system. There's a range where it can self-regulate. If you go out of that range into sympathetic hyperactivity far enough, the ANS gets stuck in sympathetic hyperactivity and then the parasympathetics can't function. So one of the things that does is it vasoconstricts vessels throughout the whole body. Nitrous oxide, the way that Viagra and Cialis and the other drugs work is they vasodilate the vessels, which allows more blood to go to the penis so you can get an erection. The way an erection works, you guys, is there's valves in the veins, right? The valves are going up towards the heart so the blood can push the valves open and then it usually can't go backwards because the valve's shut. To get an erection, what needs to happen is we need enough vasodilation, enough arterial blood going to the penis where the internal pressure of the arterial blood takes those valves and passively closes them off all the way. So now there's blood going to the penis, but there's not blood coming back from the penis, and that's what helps maintain an erection. If the valves get partially closed off, but they maintain a little bit of openness, now the blood can go forwards and backwards, and that's when guys will get an erection and then lose an erection. And there's lots of different ways that can happen. But the problem with erectile dysfunction, just like the problem with all other pelvic floor impairments, it's not as obvious with some of the other ones, but decreased blood flow, secondary to chronic sympathetic autonomic nervous system hyperactivity, is an underlying cause of all pelvic health impairments. And the underlying cause of all pelvic health impairments, the underlying cause of 99% of them, is sympathetic autonomic nervous system hyperactivity. So if the pelvic floor muscles are very parasympathetic dominant, which they can, all 9 of them are innervated by some combination of S2 to S4 in the sacral plexus, which is a parasympathetic dominant part of the spinal cord. The only true pelvic floor muscle that has innervation outside of S2 to S4, you guys, is the obturator internus. That has some lumbar innervation, but that's the only one. So they're very parasympathetic dominant. If the sympathetics tend to get hyperactive in humans, the parasympathetics get depressed. And what happens to the pelvic floor muscles is they get into a state of chronic hypoxia and chronic contraction where they're stiff and rigid and they can't contract and relax anymore. It's not that the muscles have lost their ability to contract, and it's not that the muscles need to be stronger. Strengthening a super hypoxic, sympathetically hyperactive pelvic floor is doing nothing but making it worse because you're making everything contract more. Sympathetic hyperactivity is the underlying problem, you guys. This is why exercise basically does not work for pelvic floor impairments. Every single patient that I get when I treat them, the typical story that they have to some degree or other is I've been getting treatment for this for the last 10, 20, 30 years. Sometimes it makes a tiny bit of a difference. It helps maybe for a little bit, but it never actually changes anything. So they try it and they stop going. And then the reason that I'm able to totally fix this stuff in typically 5 treatments or less, you guys, is because I'm approaching this from the viewpoint of the muscles are fine. The autonomic nervous system is not fine. It's like looking at a hole in the bottom of a boat. And instead of patching the hole, you just hand your buddy a cup and decide to just keep scooping water out of the boat rather than fixing the hole that's right there. This is the approach of mainstream medicine. Let's treat the symptom of the problem, and this is not on accident, so nobody ever gets better and they need to continue to take this medication for life. Erectile dysfunction, incontinence, pain with sex, all pelvic health impairments, unless there's a specific underlying structural damage, like damage to arteries, damage to organs, severe, like cancer, stuff like that, you guys, barring that, nobody, guy nor girl, should be suffering from pelvic health impairments, and I don't care how old you are. And another thing that we go over in this class, you guys, is how important it is to treat the pelvic floor on 100% of your patients, including young patients, you guys. The most incontinent group of people that I see on a consistent basis, and this is spoken about in literature, if you talk to athletic trainers and people that treat athletes a lot, this is very, very well known, you guys. High school and college female athletes are some of the most incontinent people out there. And they're not incontinent like they have incontinence all the time. Typically, and you can see videos of this, like CrossFit people, military people, it's that they'll have incontinence when they're doing stressful activities or doing certain things like squatting or running. And the reason that happens is because there's no dynamic balance to the autonomic nervous system. The sympathetics are pegged all the way on. So once the bladder fills up enough, or once the pelvic floor gets activated enough, it tries to do what it needs to do, but the hyperactive sympathetics are stopping the parasympathetics from turning on enough, which does not allow normal function in the pelvic floor. So if you normalize autonomic nervous system homeostasis by depressing sympathetics, elevating parasympathetics, the muscles take care of themselves. Again, things in the body, you guys, don't make themselves dysfunction. Muscles don't get weak for no reason whatsoever. If you're not literally sitting in a bed or bed bound 100% of the time, if you're getting up and down and standing up out of your chair and walking and stuff, there are 0 adults whose pelvic floor is not strong enough for average function, right? If you're not playing a high level sport and you don't need to be doing like super strenuous activities, 99.9% of the human population has a pelvic floor that is plenty strong enough. You guys, babies don't have incontinence because their pelvic floor is weak. Their pelvic floor is functioning fine. They have incontinence because their nervous system is so dysregulated when we're growing. And babies' problem a lot of the time is there's too much connectivity. The parasympathetics can actually become hyperactive, which can lead to excessive going to the bathroom and things like that. But the problem is not that the pelvic floor can't contract and relax. It's that the brain is not communicating properly with the pelvic floor. The same reason little infants have incontinence is the same reason that everybody else has incontinence. It's just happening for a slightly different reason in a slightly different way. It's dysregulated nervous system, but it's due to different factors when you're younger. When you're older, it is due to sympathetic hyperactivity. When you're younger, it's just due to the fact that you're not consciously aware of what's going on in your body. There's too many things connected all at once. It's why we're uncoordinated. For kids that wet the bed at night, that is one of the only parasympathetic dominant problems that's relatively common to see, is that the reason that a lot of kids wet the bed is because when they're sleeping, their parasympathetics are elevated so heavily that it's almost the reverse of an adult's problem, where the parasympathetics are on so strong that when the bladder fills up, it is not enough of a stimulus to wake up the person. The bladder filling up elevates the sympathetics. That typically depresses the parasympathetics and you'll wake up. If the parasympathetics are on so heavily, when the sympathetics start to elevate, they just get inhibited from turning on enough and you don't wake up, and then you go to the bathroom when you're sleeping. The same thing happens with adults for the opposite reason, more or less, is that instead of the parasympathetics becoming hyperactive when you're sleeping, the sympathetics are hyperactive when you're awake and when adults are sleeping. It keeps their pelvic floor from working well. It keeps them from sleeping. It keeps the parasympathetics from turning on. It dysregulates our hormones, and it causes hypoxia, nitrous oxide pathway irregularities, muscle shortening, muscle contraction, chronic muscle contraction, and it does not allow dynamic stability of the pelvic floor. This is a super duper easy thing to fix. You don't need any special skills. You do not need to be a pelvic health specialist to work on this stuff, you guys. There's no rule about that. I've taken plenty of pelvic floor courses. I'm not a certified pelvic health specialist. We're doctors of physical therapy. You don't need a specialty to treat this stuff. If you're trained properly, you can do way, way better for your patients than the vast majority of trained pelvic health specialists, you guys, because the vast majority of people with a pelvic health specialty do not understand how the pelvic floor works or how the autonomic nervous system works. And the vast majority of people that are treating the pelvic floor, even if they do, you guys, this is one of the treatments that if you don't have needles and you don't understand how to use dry needling, I honestly don't think this is a fixable problem on a lot of people if the problem has been going on long enough, because needling has such an outsized, powerful effect on the autonomic nervous system that it shifts it and it pushes it back into that land of self-regulation way more dramatically than any other treatment that we have. So if you're aware of that, if you're understanding why people have incontinence, why people have pain with sex, why people have erectile dysfunction, why people have pelvic floor impairments in general, and it's the same reason that people have most other impairments in general, right? Pelvic health stuff is considered idiopathic. Erectile dysfunction, considered idiopathic. Most problems, chronic problems that people suffer with for life are considered idiopathic. And the only reason they're considered idiopathic is because our medical system is set up to not fix things. When your solutions are surgery or a pill, and you don't have you don't have a pill for it, surgery is not possible, or they don't work, patients get told that they just basically have to live with it for life, and that they have to take this expensive medication for life, which is the plan. I absolutely guarantee you guys, if we trained enough people to utilize needling in this way, we could get rid of over 90% of pelvic health impairments in the United States without pharmaceutical medication very, very easily. And by doing that, you improve everything else too, because as the nervous system gets more homeostatic, not only does the pelvic floor function better, everything else functions better, you guys. The jaw, headache problems start to go away, brain fog gets better, hormones get more regulated, you have more energy, your mitochondria start to produce more energy, your body just has more energy availability to do the things that it needs to do. And the other cool thing about needling, you guys, is if you understand how to use needles correctly, you can directly contact 8 out of the 9 pelvic floor muscles on both guys and girls without ever exposing the genitals. And the reason that most pelvic health specialists do internal work, you guys, on females and on guys, is to access the deepest layer of the pelvic floor muscles, which would be the levator ani complex. It's the deepest layer, back by the coccyx. And the reason that pelvic health therapists will go intravaginal or intrarectal to get those muscles is because you have a bunch of tissue over the top of those muscles. Over the top of those muscles, you have the glute max, which is very thick. You have the hip flexors. The pelvic floor muscles are not easy to access unless you have needles. And the reason that regular treatment doesn't work a lot of the time for pelvic health impairments, you guys, is because it's not creating enough of a stimulus to the brain to make it aware of what's going on in the pelvic floor and to cause a change. The needling is the only direct contact of tissue we have underneath the skin anywhere in the body. It's the only tool that we have access to that can directly touch subcutaneous tissue. And that direct contact of the tissue is one of the primary reasons why dry needling regulates the nervous system much, much more than any other treatment that we do. And it's because it's that direct contact of the tissue with the needle alerts the brain, and it's like, hey, pay attention to what's going on here, right? We know that when people have strokes, you lose communication, the brain stops communicating with certain parts of the body. That is the problem. The same thing is going on in the pelvic floor. It's like having a mini stroke in your brain, or like a bad concussion that just knocked out that part of communication between your brain and your muscles and your autonomic nervous system. By specifically targeting the pelvic floor, along with everything else in the body, guys. So pelvic health impairments should not be treated different than other impairments. The underlying goal should always be to maximally regulate the autonomic nervous system. And to do that, we need to target as much tissue pathology throughout the body as we can while focusing on primary area of complaints, and also targeting specifically the parasympathetic portion of the autonomic nervous system. So the vagus nerve, the auricular branch of the vagus nerve in the ear, C2 and up, the cranial suture lines, suboccipital musculature, and then the pelvic floor itself and the sacral area. So that would be the parasympathetic dominant areas.